Many people grow up hearing the same phrase, blood pressure of 140 is normal for your age. This idea has been repeated so often that it sounds almost like a medical rule. But in reality, this belief can be extremely dangerous. Blood pressure represents the force with which blood moves through the arteries. When that force remains elevated for many years, it slowly damages the vascular system. The problem is that this damage happens silently. Most people with high blood pressure feel completely normal. They have no pain, no clear symptoms, and nothing that forces them to seek treatment. Because of this, many people ignore numbers around 140 and assume that their body has simply adjusted to aging. However, arteries do not adapt harmlessly to higher pressure. Instead, they gradually become thicker and less flexible. This process is called arterial stiffness. When arteries stiffen, the heart must work harder to push blood through the circulatory system. Over time, this increased workload affects the heart muscle, blood vessels, and other organs. That is why modern medicine no longer considers blood pressure of 140 to be harmless. Blood pressure readings consist of two numbers. The first number, called systolic pressure, measures the force created when the heart pumps blood into the arteries. The second number, diastolic pressure, reflects the pressure in the arteries between heartbeats. When blood pressure is around 120/80, the cardiovascular system usually functions efficiently. But when systolic pressure rises to 140 or higher, the heart must pump against significantly greater resistance. This may not cause immediate symptoms, but it gradually increases stress on the cardiovascular system. Even moderate elevations in blood pressure can have long-term consequences. Studies show that the risk of stroke, heart attack, and vascular disease increases steadily as blood pressure rises. This means that pressure values around 140 should be taken seriously rather than ignored. The numbers on the monitor are not just measurements. They reflect how hard the heart must work to maintain circulation. People age. Blood vessels naturally undergo structural changes. Healthy arteries are flexible. They expand slightly with each heartbeat and then return to their normal shape. Over time, however, the walls of the arteries may become thicker and less elastic. When this happens, blood pressure tends to rise. Because this process is common, many people assume that higher pressure is simply a normal part of aging. But there is an important difference between something being common and something being healthy. Arterial stiffness increases cardiovascular risk. It places additional strain on the heart and reduces the ability of blood vessels to regulate circulation. Instead of accepting higher pressure as inevitable, modern medicine focuses on slowing or preventing these changes. Maintaining healthy blood pressure helps protect blood vessels and reduces long-term risk. High blood pressure is often called the silent condition. Unlike many illnesses, hypertension rarely causes clear symptoms. People may feel completely healthy while their blood vessels are slowly being damaged. Inside the arteries, high pressure creates mechanical stress on the vessel walls. Small injuries appear along the inner lining of the arteries. These injured areas can become sites where cholesterol deposits accumulate. Over time, this process leads to plaque formation, known as atherosclerosis. Atherosclerosis narrows arteries and reduces blood flow to vital organs. This is how hypertension gradually increases the risk of heart attack and stroke. Because the process develops slowly, many people underestimate the danger, but the damage accumulates year after year. The heart is the organ most directly affected by high blood pressure. When pressure rises, the heart must pump with greater force in order to circulate blood. At first, the heart adapts by thickening its muscle. This adaptation may temporarily maintain normal circulation. However, over time, the thickened heart muscle becomes less flexible. The heart may begin to fill less efficiently and pump less effectively. This condition is known as left ventricular hypertrophy and can increase the risk of heart failure. High blood pressure also increases the likelihood of coronary artery disease, which reduces blood flow to the heart muscle itself. This combination of factors significantly raises cardiovascular risk. High blood pressure does not only affect the heart. The brain contains extremely delicate blood vessels that are sensitive to pressure changes. Over time, hypertension may damage these vessels and increase the risk of stroke. Even smaller injuries to brain vessels may affect memory and cognitive function. The kidneys are also highly vulnerable. These organs rely on tiny filtering structures that regulate fluid and electrolyte balance. When blood pressure remains elevated, these filters may gradually become damaged. Kidney function may decline slowly, often without noticeable symptoms in the early stages. This is another reason why controlling blood pressure early is so important. The belief that blood pressure of 140 is normal for age may appear harmless, but in reality, it often delays treatment for years. During those years, silent vascular damage continues to develop. By the time symptoms appear, the cardiovascular system may already be significantly affected. Modern medicine emphasizes prevention. Monitoring blood pressure regularly, maintaining healthy habits, and seeking medical advice when numbers remain elevated can help reduce long-term risk. Sometimes the most dangerous health problems are the ones that feel completely normal. And questioning old myths is often the first step toward protecting your heart and blood vessels.